Bonjour tout le monde. C'est vrai que j'ai gradué en français, en lettres français de Glendon. Malheureusement, j'ai aussi fait du travail au niveau gradué à l'Université de Toronto, ce qui m'a rendu assez mécontent vis-à-vis le système académique. Alors, j'ai bien appris le français ici, sous la direction du professeur Alain Baudot, que vous connaissez sans doute, ou beaucoup d'entre vous connaissez. Mais actuellement, je n'emploie mon français que pendant des entrevues avec Radio-Canada, ce qui est bien dommage. I'm going to talk a bit about a couple of topics, one in particular that has seized the attention of the public and chattering classes a lot these days, which is the legalization of marijuana coming up, but I'm going to blend it a bit with tobacco. And there's something like a mild hurricane going on in a mild version of Irma going on in the public health community about pot legalization. Many people are seized with this issue. Civil servants are spending an inordinate amount of time working up strategy. I was at the legislature the other day for a meeting with someone, and we went a bit over time, and the two of us came out to sort of humble NGO workers, and there were like 6 cabinet ministers and about 20 staff standing there waiting for a meeting which we'd prevented them from going into because we were running late, about cannabis. And this was about a week before the strategy was announced. So this has got, that's only to say this has got the attention of governments at the most senior levels continuously. And some of those meetings, if they're federal, provincial, as you can imagine, are pretty contentious these days because the provinces have been given this drop-dead date of July 1st for the legalization of marijuana. And they are not ready. Ontario has announced its strategy. You probably heard some news reports of that recently. But this whole issue has gradually polarized into pro and anti camps. Families are discussing it. Young people are discussing it. It goes on and on. There are many producers and those on the business side who are lobbying like crazy to grab sections of the market before it starts off on 1st of July. So it's an extremely active area. Despite the pleas from public health and provincial governments and police forces to the feds to delay the 1 July 18 implementation date for legalization, they are standing firm. So there is no plan at the moment to do anything about that. And it's going to be very interesting to see how that unfolds. We've been dragged into the debate. Normally I work on tobacco control, and I'll get to that in a few minutes. But the provinces have been given some authority over marijuana, notably on the issues of where it can be used, where it can be smoked in this case, because the federal bill that's coming in to legalize the substance does not cover edible or drinkable forms of marijuana. So the provinces have authority over where it can be used and the retail system. And I think I saw this morning an interesting little nugget in a Marcus G. column in the Globe, which said a lot to me, not only about this issue and the misconceptions around it, but about the larger issue of tobacco and tobacco control, which is something that no one, I wager, in the room spends very much time thinking about, but which I'll argue is extremely important. Marcus was doing a critique of the Wynne government's, several Wynne government interventions in the marketplace. He talked about rent control. He talked about the placement of marijuana cannabis sales in government retail outlets, and there was one other thing that I forget, one other policy. And he referenced the fact that, gosh, why would you need government-run pot stores? Because there are inspectors for tobacco and alcohol, and the phrase that got me was, these inspectors ensure that tobacco and alcohol products are safe and quality controlled. Now, that's the first time in a long, long time on any side of the tobacco argument I've ever heard anyone refer to tobacco products as either actually or potentially safe. And that to me just is simply a function of the fact that since we have smoke-free places, we've had them for about 10 years now, most people, and increasingly younger people, either don't see anyone who smokes or don't know anyone who smokes. So therefore, what's your conclusion? Tobacco's done. Similarly with pot, I used to call it dope. I don't know. Dope sort of sounds slightly pejorative, so I usually try and say pot or cannabis, but cannabis sounds unnecessarily fussy. I think that we've been victims of our own success in the area of tobacco control. I don't think that's going to be the case with cannabis. And I'll just project ahead a little bit on the cannabis issue. When it is legalized next year, there will be no cannabis smoking anywhere, and presumably that means using vaping as well, electronic cigarettes. There'll be none of that in any place where tobacco smoking is not allowed. That also extends because they are basically treating marijuana, cannabis products as alcohol. That extends to no smoking in public. Now, I don't know how many of you have walked in downtown Toronto a fair bit over the last several years, 10 years, but I know in my case, my office is at the Ontario Medical Association at Bloor and Avenue Road. I can walk across to Yonge, and if I am careful about who I follow, I can be pretty high by the time I get back to the office at any point in the day. So that's all going to be suddenly, as of 1 July, under the auspices of our police forces. Because just as you can't drink a beer walking down the street or knock back a bottle of bourbon walking down the street, also you won't be able to smoke marijuana walking down the street or in any other place. So, public place, that is, or workplace. So you're going to be confined to your home if you want to smoke. Just as many, many smokers are now not totally confined to their homes, but pretty well. Those homes include multi-unit dwellings. And apartment buildings are one of the worst places for exposure to secondhand smoke that are left. We get our associations, I represent the OMA, the Cancer Society, the Heart and Stroke Foundation, and Non-Smokers' Rights. We all get constant complaints from people about secondhand exposure to tobacco smoke, which is quite toxic, in apartment buildings. And we're now going to have not only secondhand smoke exposure to tobacco smoke, but also to marijuana. And we're going to have a serious problem there. So that is not going to make it easy to enforce this whole area. The reason I keep referencing tobacco in this is because tobacco is a demonstrably much more harmful product. It kills 13,500 Ontarians prematurely every year, kills more people in this province than murder, suicide, illicit drugs, and alcohol abuse and use combined, and costs the provincial economy somewhere north of $9 billion in direct healthcare costs and foregone income and lost productivity every year, as against about $1.2 billion in tax intake. So tobacco needs to be significantly reined in. Canada has quite an enviable record internationally on tobacco control, but that says more about the weakness of many other countries than it does about the strength of our efforts. Ontario has an excellent tobacco control strategy, including a lot of help for smokers to try to quit. But when it takes an average of about 25 to 30 quit attempts before you succeed, that's the generally accepted stat in public health, you can see the difficulty in encouraging a lot of people to quit and also having your strategy to control this extremely expensive, dangerous, and harmful product effectively. Just to move to the larger scale internationally, and I don't know whether Steve will have anything to say about this or not, or whether we even know anything about this. We smoke about 10 billion cigarettes a year in Ontario. Each cigarette produces a number of cubic feet of carbon monoxide and carbon dioxide, as well as many other toxins. That is 1 year's consumption in one Canadian province. If you blow that up to the international level, looking quickly at China, there are 350 to 400 million smokers in China. Most of them are long-term smokers. That means most of that number will die prematurely. And before they die, they will suffer lung cancer, heart disease, and many other cancers in record numbers. And the Chinese economy is going to be faced with a healthcare crisis, the likes of which no other country has ever experienced, I think, in this kind of context. So when we talk about economics and international relations and so on, this is an important underpinning to the international economy. The international tobacco industry over the next 20 years is going to be responsible for 1 billion deaths worldwide as a result of use of its products. Imagine the contribution that all those people could be making to their families, their communities, their employers, and who knows, maybe a few of them on the elected level and in intellectual circles, et cetera, et cetera. It just boggles the mind, but it's not an issue that's done, and we continue to struggle with it here in Ontario and elsewhere in Canada. Thank you.